We're so excited you signed up for the Chronic Neck Pain Secrets Workshop and we get to meet you. I'm Dr. Gord here at National Spine Care and Sports Medicine. You know, we've helped hundreds of people just like you discover why you may be continuing to suffer from chronic neck pain and headaches. So check your email because we just sent you instructions on how you can get access to this Zoom webinar. I want to give you a sneak preview of what we're going to share in the workshop. See, if you're like most of the patients we see, you spend a lot of time and money going through various treatments and healthcare consultations, but still continue to suffer. The problem is that the old school approach to helping people with neck pain revolves around what is called a structural diagnosis. That approach follows the logic where if you can identify and diagnose which tissue or tissues have been injured, then we can organize and prescribe treatment to fix those injured tissues. Once those injured tissues have been fixed, then the pain should resolve and you can get back to normal. So how's that worked out? Well, if you're like most of the other people experiencing ongoing neck pain, then you realize that that approach hasn't worked out very well. The research outcomes have certainly told us that that approach only helps a very small number of people. You know, if we look at people that have been injured in motor vehicle accidents, for example, research has shown that 59% are still experiencing significant pain 6 months later, up to 40% still in pain 2 years later, and even 10% never seem to recover. This is such a big problem that the World Health Organization now considers persistent neck pain as one of the leading causes of disability in the world. How can that be? We know from basic science that the tissues that get damaged from an injury knit themselves back together and heal within 2 or 3 months. So how is it that even though the tissues have healed, the pain continues? That question has shifted our thinking and clinical approach. This new school approach means that in addition to the structural diagnosis, we add a functional assessment and diagnosis. This is what we're so excited to share with you in the upcoming workshop you've signed up for. You see, way back in 2002, yeah, I know, it's almost 20 years ago, we were part of an international research project that used a sophisticated piece of technology to measure and objectively quantify how strong your neck is. We ran these diagnostic tests on hundreds of people who were suffering from chronic neck pain and headaches. On average, those patients had had their neck pain for more than 8 years. That's a long time to be suffering. We discovered that even though the original injured tissues had healed, the body was still compensating and the strength of their neck never fully recovered back to normal. We know that this phenomenon is common in other areas of your body, so those of us in rehab know that when you have injured something like a knee or a shoulder, you need to rebuild the strength in order to get back to your activities. But for some reason, however, this approach wasn't being done for the neck injuries. The good news is that once we discovered this, undiagnosed weakness, we were able to use the same piece of sophisticated equipment to help those patients rebuild their neck strength. How did we do? Well, it turns out that this was the missing link for those patients, finally being able to get out of pain and get back to normal. On average, the majority of patients were able to reduce their pain and disability by more than 60% and double their neck strength in only 6 short weeks of treatment. Now keep in mind, these people had had their problem for a very long time, on average more than 8 years. We've since gone on to show that sooner you diagnose the problem, the easier it is to correct and the better the results. So if you've had neck pain for more than 3 months, it's likely that this common undiagnosed underlying problem is limiting your recovery. So during the workshop, you'll get to watch us do an actual assessment on the neck machine so you can see for yourself how simple the test is. If you don't want to wait for the webinar, however, then you can jump on a call right away. We've created a free discovery consult where you can meet with one of our therapists to discuss your unique situation. This can either be a phone call, a video chat, or an in-clinic visit to determine if this might be the cause of your ongoing pain. Thanks again for signing up for the workshop. We're really excited to share this information that has helped thousands of people just like you recover from chronic neck pain and headaches and get back to their normal life.